traveled to the Limestone Coast in South Australia, I was feeling excited because I was going there to talk to patients and families and staff about some of my favorite topics, including humanity and healthcare. I was also feeling a little bit nervous because I'd never met anyone in person before. I'd certainly had Zoom conversations with the organizers, but it would be the first time that I met Emma Poland and her team in person. So it was a combination of excitement and anxiety. What I was hoping to achieve with my visit to Limestone Coast was to help create a safe space for staff and consumers alike to talk about what is important in healthcare. Some of the things that are important for me in healthcare include things like demonstrating kindness through acts of compassion, providing safe spaces for people to have meaningful conversations together, including the consumer voice. Also, storytelling to me is really important in healthcare for both staff and consumers. Lots of the soft stuff. I'm kind of a soft stuff person. Soon after, Dr. Darwish knocked on the door, came in and introduced herself. The very first thing she did was scoop slumbering Aaron up out of his car seat and held him in her arms. Today, many years later, I can still close my eyes and recall this well-dressed physician cuddling my son. It was a powerful image. Dr. Darwish was the first clinician to see Aaron as a baby first. She didn't immediately zero in on what was wrong with him. She saw and expressed what was right. She continued chatting with us. It must have been quite a shock for you to find out about the Down syndrome. This opened the door for us to talk about how we felt about Aaron's diagnosis. Again, not one other clinician had asked us how we were emotionally. They all talked about risks, statistics, and data. Nobody focused on what was invisible to the eye. He was not a lab specimen to her. She treated him with such dignity as if he was her own child. It is absolutely crucial to show appreciation for health professionals because I don't think that patients have the time or ability or space for us to give positive feedback back to the people who care for us in healthcare settings. So I think we need to say thank you more. We need to be given chances to say thank you more. Kindnesses are not actually that small for patients. They mean a lot to me when I'm sick and vulnerable and worried. And I think sometimes what's a big deal to patients isn't a big deal to clinicians because you see it every day in your everyday life. So, but we might be going through one of the worst moments of our lives when you encounter us. I think clinicians and staff have a huge role in adding more humanity to healthcare, and part of that is allowing themselves to be vulnerable and sharing a bit of their own stories with the patients that they serve. Because in sharing stories, that's how we create connections together, and really storytelling is where our shared humanity lives. So healthcare has a lot of soft skills that are involved with it. And that's because healthcare is about caring for other human beings. So I think sometimes we focus a lot on the technical skills, the things on the task. But the thing is, you're dealing with people, and patients are people who are vulnerable. And it's really important, I think, to consider kindness, which I consider compassion or acts of kindness, things like warm blankets that you hand out to patients, as really important elements to help people heal. I'd love to encourage clinicians to do more of the so-called soft skills, like sitting with a patient and listening, perhaps a hand on the shoulder, a hug if appropriate, all those so-called soft skills, because they mean a lot to patients. I think they're very healing for patients. And part of the role, I think, of administration is to ensure that clinicians have the time. So you don't take the time to do those things, you make the time. It's something very meaningfully and purposefully you have to do. So I think that admin needs to recognize and reward and value those kinds of behaviors as much as they do, say, technical competencies. People at Limestone Coast really responded warmly to the healthcare and humanity events. I hope you can make time for more reflective practice sessions in the future. As I say, staff well-being and patient well-being are intertwined. Importantly, as a patient, I care for the people who care for me when I'm at my most vulnerable. This is a call for more warm blankets for us all, patients, carers, and staff everywhere.